Okay, so today we're going to talk about the medications and supplements that can actually result in gastric reflux or even worsen gastric reflux. Okay, so sometimes it's not about the lifestyle or the food that you are taking. Okay, some supplements, okay, nutritional supplements can actually result in having gastric reflux. So that's something interesting and to note. Yeah, and also some medications, okay, that people are taking for other conditions, okay, it can also result in gastric reflux. So a lot of times that's the reason why sometimes certain drugs are being prescribed together with other medications such as omeprazole, okay, just to reduce the gastric irritation. All right, so let's see. Okay, so there are medications that can irritate your esophagus, which is your food tube, and can cause heartburn pain. Okay, so some of them will include antibiotics. Okay, antibiotics mostly for tetracycline and also clindamycin. Okay, these are some of the examples, okay, that can result in the food tube being irritated, all right, and resulting in heartburn pain. Also, there's a group of medications called the bisphosphonates, okay, which is taken orally. All right, and this is actually for osteoporosis. All right, so especially for elderly, all right, people with a lot of weak bones issues. If this is prescribed, sometimes it can also cause gastric reflux. Okay, and there's another one. It's called quinidine. Quinidine is actually for heart patients with irregular heartbeats. And also another group of supplements or medications is the pain relievers, okay, such as ibuprofen and aspirin. All right, so some people may have gastric reflux from taking painkillers even. Okay, so there are also nutritional supplements which I will share with my platinum group for this. Okay, so what the above mentioned medications and supplements, they actually cause the food tube, or we call the esophagus, okay, to be irritated, and that's resulting in the heartburn. Okay, and then there's another group of medications and supplements that can increase gastric acid reflux. Okay, so it can increase the gastric acid juice to produce more. Okay, so that's another mechanism. So one is irritation of the food tube, okay, which is where most of the gastric reflux occurs, and another mechanism is actually cause the gastric acid to produce more than usual. Okay, so there's the group called the anticholinergics. Okay, and they are actually prescribed for irritable bowel syndrome. So some people with irritable bowel syndrome, okay, they have this, but when they take it, okay, ultimately it also causes gastric pain or gastric reflux or heartburn. Okay, and also for people with overactive bladder, this anticholinergics, okay, will be prescribed, okay, to prevent them from having overactive bladder, which will result in frequent urination. Okay, that also occurs a lot in the elderly. All right, and then there is the antidepressants. Okay, there's a group of antidepressants which we call the tricyclic antidepressants, okay, which will also cause gastric juice or gastric acid to produce more than usual, okay, which will worsen the gastric reflux. And then what else is there? Quite a lot. Okay, so there's another group called so more for the heart diseases and high blood pressure. Okay, so statins, and also nitrates, calcium channel blockers. Okay, so some of these heart medications, okay, can cause gastric reflux. So you may realize a lot of times there may be heart patients, okay, having lots of other issues as well, cholesterol, blood pressure, and also gastric, digestive issues. Yeah, so they all come together as a package, okay, because one thing lead to another. Okay, so it's the medications actually will result in more illnesses, okay, than usual. Okay, so you may find that after you start taking certain medications, Western medications, okay, more and more problems will start to surface, okay, because they come with a lot of side effects, and one of them is the gastric reflux. Then another group will be the opioids, narcotics, okay, so again is the painkillers. So a lot of times it's also painkillers. Usually the opioids are taken by cancer patients, okay, with a lot of cancer pains, okay, so on top of the pains that they have to deal with, okay, after taking the medications, they will have to deal with heartburn, gastric pain problem, okay, which is not really solving issues. And maybe I'll just talk about, okay, one more. So for lung diseases, theophylline is another group of medications, okay, that is usually prescribed. So for asthma patients especially, yeah, so when that is prescribed, okay, ultimately they will actually have a lot of gastric problems as well. So that's for the lung problems, okay, asthma, bronchitis, okay, a lot of patients taking theophylline, okay, that's a group of medications that will cause gastric reflux, and through the mechanism of increasing the gastric juice production. Okay, so there are many other classes of medications and dietary supplements that can cause gastric reflux and increase in gastric juice or irritating the food tube. So other than that, I will be sharing on my platinum group. So yep, that's about it. So I think what you have to take away from today is to realize that, you know, sometimes when it may not be just the food, it may be the medications and drugs that you are actually taking that is causing a lot of other gastric issues, which is heartburn is one of them. And yes, these are the side effects and the price you have to pay, okay, to maybe to suppress one part of the problem and then but to create more problems from there. Okay, and then I'm going to switch to channel 8. So I'll be speaking in Chinese. Yeah. 好，所以今天呢就要谈关于一些可能会导致那个胃酸反流的一些药物和补充膳食的一些营养品哦。所会造成的那个胃酸反流的效果比较显著哦，就是有两个就是途径吧，这些药物和那个补充剂哦，膳食补充剂所会导致那个胃酸反流。一个方面呢是它们会导致那个食道的刺激会比较多，从而造成那个胃酸反流比较厉害，而且胃灼热疼痛的症状会比较显著。然后另外一个途径呢，就是通过导致那个胃酸的怎么说呢？就是胃酸它制造的比较多，从而呢它会侵蚀胃黏膜这是另一个途径，就是导致胃酸分泌的比较多，所以两个途径，一个是刺激食道，另外一个是增加胃酸的那个量，而导致那个胃黏膜的侵蚀哦，还有导致那个胃灼热感、疼痛增加。那其中一个呢，就是我们先谈关于胃灼热疼痛药物还有膳食补充剂所会导致食道刺激比较多的一些药物，还有那个膳食补充剂哦。一个呢就是抗生素 那四环素和克林霉素很多都是会造成那个食道的刺激比较多，而从而导致胃酸反流和胃灼热疼痛。然后呢，另外一个呢就叫做口服双磷酸盐这个口服双磷酸盐呢，它通常是对骨质疏松的病人就是服食的比较多。而由于这样子呢，为了就是让那个骨质疏松变得比较缓和的话呢，他们通常也会造成胃的一些不舒服就是通过那个食道的刺激。还有呢，另外一个就是归尼丁。归尼丁呢，它通常是对那个心跳忽律的病人会开的比较多，而这些心脏病的病人呢，通常也只能靠这些药物来让自己的那个心跳比较规律，但是它的那个副作用就是胃酸反流还有呢，多一个就是止痛药很多的止痛药，如阿司匹林这些的布洛芬特别是这些，通常也会导致食道的刺激比较多，从而很多的胃疼胃酸反流的症状也会跟着出现所以你通常会发现就是在止痛药的那个服用的时候呢，一般上也会就是那个西医们呢，他们也会给予一些其他那个保胃的药就是因为知道它会刺激那个食道或者让胃酸增加所以为了压制那个其他的副作用呢，就得靠别的西药来压制。所以这样子呢，好像解决了一个问题，然后又制造另外一个问题还有呢，接下来就是另外一些药物会导致胃酸增加的药物，还有那个膳食补充剂那比如说那个抗胆碱能药它是治疗膀胱过度活动症还有肠易激综合症的药。这些呢会导致胃酸分泌增加这样的话就会侵蚀胃黏膜，也导致胃酸那个胃灼热疼痛增加。然后还有一些就是抗抑郁药，三环类抗抑郁药这些呢也会导致胃酸增加。还有另外一组呢，就是用于高血压还有心脏病的钙通道阻滞剂还有那个硝酸盐这些呢是用来治疗高血压心脏病的药物。但就比如刚才另外一组药物是让心脏跳动的规律比较缓和和稳定的那个药物呢所以很多的那个心脏的一些药物也会导致胃疼痛、胃酸反流增加、胃灼热疼痛还有呢，就是最后一组我会在这里分享的，就是茶碱。茶碱呢是用于治疗那个哮喘病还有那个那叫什么呢？那个肺部的疾病，肺炎等等的疾病这个呢就是咳嗽哮喘的疾病这些比较多的话，茶碱会被就是服用的比较多，那这样呢也是会造成很多的胃部的疾病就导致那个胃酸增加、胃黏膜侵蚀，然后那个胃的刺激疼痛灼热感也会增加。所以呢就是这样，然后其实还有很多的那个不同的药物还有膳食补充剂 但我会在我的另外一组分享比较多哦。然后所以总而言之呢，就是要了解到，有些时候可能不是因为你吃的东西或者你的那个生活习惯所造成的胃灼热感、疼痛哦，还有胃酸反流增加，有时候是你在吃的一些膳食补充剂或者你在吃的一些别的西药所会造成的，这是很平常而且很多见，但很多人也不知道也不了解的。那怎么办呢？然后下周我就会分享可能胃灼热感、疼痛胃酸反流有什么一些其他的治疗方法。所以呢就是这样子先好。